Very good morning to all. Today I'm going to discuss about adrenergic receptors. So this is the basic one. So as well as very important receptors. In our human body, we have many receptors are present. For example, adrenergic receptors, histamine receptors, cholinergic receptors. Like that, we have a number of receptors present. In our syllabus, they given adrenergic topic. In that, we have some receptors present here. So first one is, before going to receptor, first you know that what is the meaning of adrenergic drugs. Adrenergic drugs are also called as sympathomimetics, which stimulate the sympathetic or adrenergic nervous system directly by mimicking the action of norepinephrine, or directly, that means indirectly, by stimulating the release of norepinephrine. So it means adrenergic drugs also we can call as sympathomimetics. So what are the main use of drugs in these drugs? It stimulates the sympathetic or adrenergic nervous system directly or indirectly. Directly means by mimicking the action of norepinephrine. So mimicking means reduce the action. That is called mimicking. Mimicking the action of norepinephrine. Or indirectly, how? By stimulating the release of norepinephrine. Only 2 points are important here. One is reduce the action of norepinephrine. Another one is stimulating the release of norepinephrine indirectly. These are the two meanings. That's all. So coming to these adrenergic receptors. So these are receptors comes under adrenergic receptors or adrenoreceptors. These receptors comes under membrane bound G protein coupled receptors. These receptors are the main action by increasing or decreasing the intracellular production of secondary messenger, that means cyclic AMP or IP3 or TAG. That means, so these receptors comes under G-coupled protein receptors. Receptors mainly increasing or decreasing the intracellular production of second messenger of IP3, and nothing but here inositol triphosphate, CAMP, that means cyclic adenosine monophosphate, or DAG, diacylglycerol. Maybe increase or decrease the intracellular production of these three. This is main use for adrenergic receptors. In some cases, the activated G protein itself, this receptor itself, operates potassium ions or calcium ion channels or increase the prostaglandin production. So in first of all telling that maybe increase or decrease the production of second messenger of CMP, IP3, DAG. In second point, some cases this coupled protein receptors itself operates potassium ion or calcium ion channel or increase the prostaglandin production. So third point is some classified into two main categories. One is alpha, another one is beta receptors. So first one is we have to see that alpha receptors. The alpha receptors having some common actions and also having some individual actions. So what are the common actions? So vasoconstriction and decreased motility of smooth muscles in gastrointestinal tract. So generally, alpha receptors having some actions and also having individual actions. So we have some common action means vasoconstriction. But vasoconstriction nothing but here constriction of blood vessels is maybe increase the BP is called vasoconstriction, or decrease the motility of smooth muscles in GIT. That means contraction of smooth muscles in GIT. So the main functions, and also fall into two main groups. One is that means subdivision. That means alpha 1 adrenergic receptors. Another one is alpha 2 adrenergic receptors. These alpha 1 adrenergic receptors found in smooth muscles of iris, arteries, arterioles, and vein. So arteries we know that means blood vessels that takes blood away from the heart to all parts. This is called artery. So this is blood vessels. So blood from heart to all parts. This is called arteries. Arterioles nothing but is a small branch, that's all, a small branch of artery leading into capillaries. This is called arteries. So vein, this means blood circulation in that way. Next one is alpha 2 adrenergic receptors, nothing but these receptors mediate the inhibition of adrenergic neurotransmitter release. So here you have 2 points very important for pharmacology part. One is inhibition or stimulation. So inhibition nothing but reduce the action or reduce the growth. Stimulate nothing but increase. So develop, it's called increase stimulation. So here alpha receptors, these receptors is to mediate the inhibition of adrenergic neurotransmitter release. So this is stopping the receptors, adrenergic neurotransmitter release. Next coming to this point is stimulation of alpha receptors. So this is common alpha 1, alpha 2 receptors if you are stimulating like this. So the stimulation is associated with the contraction of blood vessels in the bronchial mucosa and relaxation of smooth muscles. So the stimulation of alpha receptors is based on that contraction of smooth blood vessels as well as relaxation of blood muscles. Let's coming to this pharmacological action of alpha 1, alpha 2 receptors. What are the main based on pharmacological? So alpha 1 receptors is produces. So what produce actions is like mydriasis, that means a dilation of pupils. So eye problem, mydriasis, eye dilation of pupils. So vasoconstriction, as we discussed that vasoconstriction, nothing but here construction of blood vessels. This may increase the blood pressure. Increase peripheral resistance. So nothing but here maybe overcome the blood vessels through circulating system or create flow. It may be increased, that's all. So peripheral resistance nothing but here blood through circulation system or create flow. This is called peripheral resistance. Increasing the create flow or increasing the blood through circulation system. Next one is increase BP. So BP blood pressure, increase the blood pressure. So these are the works. These are drugs acting on alpha 1 receptors. So alpha 2 receptors pharmacological action nothing but inhibition of norepinephrine release. So inhibition, decreasing the release of norepinephrine. Inhibition of ACH release. ACH nothing but acetylcholine. So inhibition, decreasing the acetylcholine release. Next one is inhibition of insulin. So insulin secretion is decreased or release. Inhibition of insulin release. Maybe decreasing the insulin secretion. This is called alpha receptors pharmacological actions. Let's come to these beta receptors. These beta adrenergic receptors are G protein coupled transmembrane protein. So this also comes under G protein transmembrane protein. These receptors mediate the wide range of pharmacological response to adrenergic agonist. So another point is here agonist antagonist. So agonist nothing but favor. Antagonist means opposite. So here the adrenergic receptors comes under G protein coupled receptors and also giving from physiological response to adrenergic agonist. That means epinephrine and norepinephrine. These drugs play an important role in regulating cardiovascular response. So in serious, this drugs is mainly used for is playing an important role in regulating cardiovascular responses in health and disease. So these receptors also target the commonly used classes of drugs that block or stimulating signals. These drugs are block or stimulating work, that is signals. Block or stimulating the signals of human body. The beta blockers are often used to treat hypertension, heart failure, and used to control the heart rate in atrial fibrillation, whereas beta agonists are used to treat the asthma. So the main function is doing. So once again, so beta receptors are comes under G protein coupled receptors and also giving physiological response to adrenergic agonist. For example, drugs epinephrine, norepinephrine. These drugs are used to play important role in regulating cardiovascular system. This type of receptors are blocking or stimulating these signals, and also used to treat hypertension, so increase BP, heart failure, used to control heart rate in atrial fibrillation, where beta agonist used to treat the asthma drugs. Next, coming to this main classification of beta receptors, subdivided into three types. One is beta 1, beta 2 receptors, beta 3 receptors. So beta 1 receptors found in myocardium, that means heart muscles. Myocardium nothing but heart muscles. The beta 1 receptors found in heart muscles, where their stimulation increase the force and the rate of myocardial contraction. So this type of receptors are present in myocardium, heart muscles, and also used to their stimulation increase the force and the rate of myocardial contraction. Next one is beta receptors. This receptors found in bronchial and vascular smooth muscles, where the stimulation causes smooth muscle dilation or relaxation. These receptors are present in bronchial and vascular smooth muscles, and it is mainly used to stimulation of smooth muscles, maybe dilation or relaxation. So next one is beta 3 receptors. So these are receptors we can call which is present in fat cells, and the stimulation causes lipolysis. So lipolysis is nothing but here lipolysis. Lysis means hydrolysis. So breakdown. So breakdown of fat or other lipids by hydrolysis. So and also used to release fatty acids. This is lipolysis. Coming to these pharmacological actions of beta 1 and beta 2 receptors. So beta 1 receptors mainly produce action on tachycardia. This tachycardia is nothing but regular or irregular heartbeat. This is called tachycardia. So for example, we can say that tachycardia, how it is forming regular, irregular heartbeat. So during exercise or fear and anxiety and stress and love, anger. These are the comes under example for tachycardia. So if you're doing exercise, it will come heartbeat increase or decrease. If you have fear, it will come heartbeat. If you have some anxiety, excitement, it will come some decrease or increase heartbeat. If you have some love, angry, it will produce increase or decrease heart rate or regular, irregular heart rate. This is called tachycardia. Next one is increased lipolysis, maybe increased, so fast hydrolysis of lipids or fats to produce fatty acids. Next one is increased myocardial contractility. So myocardial, so nothing but here heart muscles contractions. So in level is increased. Next one is increased release of renin enzyme. So this type of renin enzyme is increased release, so fast release. These are the beta 1 receptor pharmacological action. Next one is beta 2 receptors pharmacological action is vasodilation. So vasodilation nothing but here. So dilation. So vasodilation. So construction nothing but construction of blood vessels. So here dilation. So free relaxation of blood vessels, which may be reduce the BP. Next one is decrease the peripheral resistance. So once again resistance nothing but peripheral resistance nothing but blood overcome to push blood through circulatory system or create flow. This is called peripheral resistance. So decreased. So these are the process are decreased. Slow process. Next one is bronchodilation. So bronchial. So respiratory tract. So dilation, relaxation. So next one is increased release of glucagon. So glucose release may be increased. Next one is relaxed uterine smooth muscles. So muscles, urinary tract muscles may be relaxed. These are the comes under beta 2 receptors pharmacological action. Next coming to this clinical use of adrenergic agents. So what are the drugs? So alpha 1 drugs alpha-1 agonist drugs, favorable drugs. This type of drugs act on alpha-1 receptors and cause vasoconstriction. So constriction of blood vessels, maybe increase the BP, and also used to along with their actions. Next one is used to as nasal with anesthetic to prolong its duration of congestion. So these are drugs also used to anesthetics. So it will produce prolonged duration of action. So relieve the congestion. Next one is alpha-1 antagonist, so the agonist. So before an alpha-1 agonist, alpha-1 receptors, favorable drugs. So here alpha-1 unfavorable drugs. This is called antagonist. These drugs, vasodilators, are used in treatment of hypertension. So used to treatment the hypertension, increase the BP. Next one is block alpha-1 receptors in smooth muscles. So in this antagonist may used to block the alpha-1 receptors work on smooth muscles. The relaxing muscles is treatment of begin prostatic hyperplasia. This prostatic hyperplasia is nothing but prostagland enlargement. Hyper means increase. Prostagland enlargement. It may cause urination difficulty. It's called prostatic hyperplasia. Next one is alpha-2 agonist. Alpha-2 receptor favorable drugs. These drugs is to relax smooth muscles by decreasing the norepinephrine release at the sympathetic nerve terminal. So the alpha-2 favorable drugs is to relax smooth muscles. So relaxation of smooth muscles by decreasing the norepinephrine release at sympathetic nerve terminal end. So beta blockers. So beta agonist. This is called beta agonist. This type of drugs is to slow down the heart rate and decrease force of contraction. So decrease the heart rate as well as decrease the force of contraction. So it's giving relaxation maybe. And also used to treatment of hypertension, angina pectoris and cardiac arrhythmias. So angina pectoris is nothing but here chest pain, maybe reduced blood flow to the heart. This is called angina. So cardiac arrhythmia is nothing but here. So improper beating of the heart. That means heartbeat improper. So improper of heartbeat. Maybe irregular, maybe too fast or too slow. These are the cardiac arrhythmias. So next one is beta agonist, favorable beta 2 agonist favorable drugs. These are drugs used to relax the smooth muscle as well as used to treatment of asthma and inhibit uterine contraction. So really used to relax smooth muscle, asthma and also inhibit uterine contraction. So these are the receptors as well as favorable drugs and unfavorable drugs. That means agonist and antagonist. So I hope you all understand this receptors and their actions. So kindly I request to you all members, study one by one freely without any disturbance, then you can understand easily. These are the basic of pharmacology. If you study it thoroughly, if you understand it clearly, then we can write easily. Not only medicinal chemistry, in pharmacology. So here medicinal chemistry, so we studied a little bit. In pharmacology, we need to study more in depth. So I request all members, study carefully and slowly and get information from some other books. Thank you to all. So next class we will discuss about adrenergic drugs and one by one. Synthesis, SAR, mechanism of action, one by one. So thank you to all once again.